are the telltale signs of a stuffy nose, the constant urge to sneeze, and the overall feeling of discomfort. These are symptoms we're all too familiar with. But how can you tell if you're battling a simple cold or struggling with the sniffles and sneezes of allergic rhinitis, commonly known as hay fever? This is a question that plagues many, and understanding the difference is crucial for effective treatment and relief. While both conditions share some common ground, they stem from different root causes and necessitate distinct approaches to management. Join us as we delve into the world of allergic rhinitis and the common cold, equipping you with the knowledge to differentiate between the two and empowering you to find the most appropriate relief. This journey into the intricacies of nasal discomfort promises to be both informative and empowering. So, let's unravel the mysteries of these common ailments together and pave the way for a healthier, more comfortable you. Allergic rhinitis, often dubbed hay fever, is more than just a seasonal annoyance. It's your immune system's way of overreacting to otherwise harmless substances, causing a cascade of uncomfortable symptoms. These triggers, known as allergens, can range from pollen and dust mites to pet dander and mold spores, lurking both indoors and out, waiting to set off your immune system. When these allergens invade your system, your body releases histamine and other chemicals in a valiant but misguided attempt to fight them off, leading to inflammation and irritation. This immune response, however, is what leads to the characteristic symptoms of allergic rhinitis, such as a runny nose, itchy eyes, and constant sneezing. Imagine a cascade of sneezes, a nose perpetually on the verge of overflowing with clear, watery mucus, and an uncontrollable urge to itch your eyes and nose. These are the hallmarks of an allergic reaction in full swing, making daily life quite challenging. The timing and duration of these symptoms can offer valuable clues about their origin, helping you identify whether they are seasonal or perennial. Seasonal allergic rhinitis, as its name suggests, rears its head during specific times of the year, often coinciding with the peak pollen season, making spring and fall particularly troublesome for sufferers. However, if your symptoms persist year-round, you might be dealing with perennial allergic rhinitis, triggered by indoor allergens like dust mites or pet dander, which can be present in your home environment all year long. Unlike its allergic counterpart, the common cold is not a case of mistaken identity by your immune system, but rather a full-fledged viral invasion, orchestrated by a variety of viruses. Rhinoviruses, the usual suspects in this microscopic takeover, are highly contagious and spread through droplets released when an infected person coughs or sneezes. These tiny invaders can linger on surfaces and in the air, making it easy for them to find new hosts. Once these viral particles infiltrate your system, they set up shop in the cells lining your nose and throat, replicating rapidly and triggering an inflammatory response. This response is your body's way of fighting back, but it also causes the uncomfortable symptoms we associate with a cold. This inflammatory onslaught is what ushers in the hallmark symptoms of a cold, a stuffy or runny nose that might transition from clear to thicker yellowish mucus as your body works to expel the virus. A sore throat that announces itself with every swallow, making it difficult to eat or drink comfortably, and a cough that can range from a mild tickle to a chest-rattling force, often disrupting sleep and daily activities. While fever is not a universal symptom of the common cold, it can sometimes make an appearance, accompanied by body aches and a general feeling of fatigue. This can leave you feeling drained and in need of rest. Unlike allergic rhinitis, which can linger for weeks or even months, the common cold typically runs its course within a week to 10 days, leaving you to recover and rebuild your defenses. During this time, rest and hydration are key to a speedy recovery. Now that we've delved into the individual characteristics of allergic rhinitis and the common cold, let's draw a clear line of distinction between these two masqueraders. A simple table can be incredibly helpful in highlighting their key differences. Feature allergic rhinitis, common cold. Cause allergic reaction to substances like pollen, dust mites, pet dander or mold viral infection, usually by rhinoviruses. Symptoms: sneezing, runny nose with clear watery mucus, itchy nose and eyes, nasal congestion. Runny nose may change color. Nasal congestion, sore throat, cough, sneezing, sometimes fever, body aches. Duration can be seasonal, lasting weeks or months, or year-round, perennial, usually 7 to 10 days. Contagiousness. Not contagious. Highly contagious, spread through respiratory droplets. Itchiness common, especially in the nose, eyes and throat. Less common fever. Rare possible, usually mild body aches. Uncommon possible, usually mild to moderate. Section 5 Over-the-counter relief, your medicine cabinet allies. Navigating the world of over-the-counter remedies for nasal congestion and related symptoms can feel like traversing a maze of options. With so many products on the shelves, it's easy to feel overwhelmed. Fear not, for we're here to guide you through the aisles of your local pharmacy. Understanding what each type of medication does can make your choices much simpler. Antihistamines. These work wonders for allergic rhinitis by blocking histamine, the chemical messenger responsible for triggering those pesky allergy symptoms. They can help reduce sneezing, itching and runny noses. Look for options like cetirizine, also known as Zyrtec, loratadine, which you might recognize as Claritin, and fexofenadine, often sold as Allegra. Each of these can provide relief from your allergy symptoms. Decongestants. As their name suggests, decongestants provide temporary relief from nasal congestion, helping you breathe easier. But use them sparingly, as prolonged use can lead to rebound congestion, making your symptoms worse over time. Pseudoephedrine, commonly known as Sudafed, and phenylephrine are common choices. These can be found in many over-the-counter decongestant products. Nasal corticosteroids. These are the gold standard for treating nasal inflammation associated with allergic rhinitis. They help reduce swelling and mucus in the nasal passages. Fluticasone, which you might see as Flonase or Veramist, and mometasone, often branded as Nasonex, are effective options. These medications can be used daily for ongoing relief. Combination medications. For comprehensive relief, consider combination medications that marry the powers of antihistamines and decongestants, such as Claritin D and Zyrtec D. These can tackle multiple symptoms at once, providing more complete relief. Section 6. Soothing your symptoms naturally. Finding natural ways to alleviate nasal issues can be both comforting and effective. Simple saline nasal sprays can help keep your nasal passages moist and clear. Steam inhalation, perhaps with a few drops of eucalyptus oil, can provide immediate relief. And don't underestimate the power of staying hydrated. Drinking plenty of fluids can thin mucus and promote drainage. Herbal teas, especially those containing peppermint or chamomile, can also be soothing. Section 7. Don't ignore persistent symptoms. If your nasal issues persist despite trying various remedies, it's crucial to seek professional help. Chronic congestion, frequent nosebleeds, or severe pain could indicate a more serious condition that requires medical attention. Your healthcare provider can offer personalized advice and treatment options. Remember, taking action early can prevent complications and improve your quality of life. Section 8. Summarizing and signing off. We've covered a lot of ground today, from understanding the causes of nasal issues to exploring over-the-counter remedies and natural solutions. Remember, your health is important, and taking proactive steps can make a big difference. Thanks for joining us, and here's to clear, easy breathing.